Question 1. Which of the following is the most appropriate indication for intubation in a child with acute severe asthma? A. Wheezing refractory to salbutamol. B. Hypoxia responsive to oxygen. C. Significant altered mental status. D. Tachypnea, 40 without retractions. Correct answer. C. Tracheal intubation is indicated for patients with impending cardiorespiratory arrest, refractory hypoxemia, severe acidosis, or altered mental status suggesting decompensation. Why should ketamine be preferred as an induction agent for intubation in asthmatic children? A. It increases mucus clearance. B. It causes vasodilation. C. It preserves hemodynamic stability and has bronchodilating effects. D. It is less expensive. Correct answer. C. Ketamine is bronchodilatory and maintains blood pressure better than agents like propofol. It's preferred in children at risk of hypotension during intubation. Question 3. What is a major ventilation goal when managing a mechanically ventilated child with acute severe asthma? A. Normalize pH and CO2. B. Use high PEEP and high tidal volumes. C. Allow permissive hypercapnia while maintaining oxygenation. D. Ventilate with rapid respiratory rates. Correct answer. C. Permissive hypercapnia is acceptable as long as pH remains 7.2. This helps avoid dynamic hyperinflation and barotrauma. Question 4. What ventilator mode may offer better gas distribution and lower peak pressures in asthma with dynamic resistance? A. Volume control with constant flow. B. PSI-MV with fixed rate. C. Pressure control ventilation with decelerating flow. D. High-frequency oscillatory ventilation, HFOV. Correct answer. C. Pressure control ventilation provides lower peak pressures and better gas distribution in obstructed airways compared to volume control with fixed flow. Question 5. Which of the following is a true statement about PEEP in pediatric asthma ventilation? A. High PEEP is always recommended. B. No PEEP should ever be used. C. Minimal PEEP may be helpful to stent open small airways. D. PEEP reverses bronchospasm. Correct answer. C. While high PEEP may worsen hyperinflation, a small amount can help prevent airway collapse during expiration. Flow time curves guide appropriate settings. Question 6. What alternative approach is mentioned when conventional ventilation fails? A. Continuous paralytic infusion. B. HFOV with increased amplitude and rate. C. CPAP plus pressure support without preset rate. D. Early tracheostomy. Correct answer. C. This strategy allows the child to control exhalation while receiving inspiratory support. It avoids overparalysis and supports spontaneous breathing mechanics. Question 7. Which is the best indicator for readiness to extubate in a child with asthma? A. Absence of all wheeze. B. CO2, 40 mmHg. C. Graphic evidence of full expiration and improving pressures. D. Normal ABG. Correct answer. C. Even with some wheezing, if peak and plateau pressures are declining and full expiration is seen on ventilator curves, extubation is reasonable.